Okay, Dr. Holden Brown, today we got to talk about lidocaine, but a little bit different than I think some people are expecting. We got to talk about lidocaine infusions. So tell us a little bit about that.
It's a treatment for chronic pain conditions. Essentially, like you said, instead of injecting it to a painful site to numb you up for a surgery or procedure, we're placing an IV and we're giving it intravenously throughout the whole body and to help decrease chronic pain for people.
That's amazing. Yeah, so from what I know, and I think probably the public perception of lidocaine is it's a very common thing in medicine, and it's used widely for any kind of local pain relief, but it's a very short-lived thing. But what you're telling me is you're treating these long-term chronic pain situations. Is that right?
Yeah, exactly. And it's you bring up a good point. Lidocaine doesn't last very long, right? So you don't typically think of a short-acting drug to treat a long-acting condition like chronic pain, some of these chronic pain conditions. But the way I explain it to patients is if you have an issue in your computer, like your hardware on your computer's fine, your microchips and your monitor, they all are fine. Nothing, unless you've dropped it, they're probably fine. But sometimes you get a bug in the operating system, in the software. Yeah. And that's like chronic pain. Your nervous system, your brain, your nerves are normal. But you have a bug in the system that's creating chronic pain. And so what happens when you call IT when your computer is having issues? What are the first thing they tell you to do is turn it off and reboot it, right?
Have you turned it off and turned it back on again?
Yes.
That's what everybody will say.
Exactly.
Yeah.
And so that's kind of what we're doing with lidocaine. So lidocaine, when you inject it on a nerve, it stops that nerve from firing. We infuse this to the whole body, so we're targeting the whole nervous system. Now, we're not turning it all the way off because you need it to stay alive, but we are suppressing it for the infusion, and then we stop the infusion and the body reboots, and we're seeing the majority of patients are getting several weeks to a month of significant pain relief.
That's impressive. Yeah. So what are the types of conditions, I guess, that you're treating? What's the classic patient that's coming in?
Yeah. So anything that the pain's lasted more than about 3 months, you're going to start developing some chronic pain pathways where your nerves, your brain get really efficient at sensing that pain. And so we'll do it for anything. So we do it a lot for fibromyalgia that's not responding to other more convenient treatments, because this is a little bit inconvenient to have to come in and do this on a regular basis. We'll do it for complex regional pain syndrome, a terrible disease that it has really tough to treat. Chronic migraines, we'll do it for patients that have had a bunch of back surgeries that their backs just aren't getting better. So pretty much anything. That's why at the end of the presentation I put a question mark, because it's like we'll use it to try to treat anything. It doesn't always work, but about 70% of the time it's working well for patients.
And is this a first line thing? Is this what you're reaching to first, or what stage in the process does this typically come up?
Great question. It's not my favorite therapy, right? Because it's inconvenient. It's usually about only a month of pain relief. I like my pain therapies that I do, I like to last months or years for my patients. So it's not my favorite thing by any stretch, but if they've tried the other stuff and it's not working, and we see a lot of that where they've been to this clinic and this clinic, and this lidocaine therapy is done at my clinic and at the University of Utah right now. I'd love it if other clinics started doing it, but they've tried a lot of stuff and nothing's working. It can be a great option for those patients. So not first line, but it could be done in conjunction with other therapies too, because there's no contraindication.
Gotcha. Yeah. What's the experience like for a patient coming in on a treatment day then?
Yeah. So they'll come in. They don't have to be fasting or anything beforehand. They'll come in. We place an IV. We start the infusion after we put monitors on. We're monitoring EKG, blood pressure, your pulse oximetry, and start the infusion. We run the infusion for 30 minutes. And then we stop it and watch you recover. The patient is probably going to feel tired, a little sedated. They could act a little bit, not like goofy drunk, but could slur their words a little bit. Those side effects are short-lived. Some patients, adverse reactions are like nausea we'll see on occasion, or headaches we'll see on occasion, but overall pretty benign. And then we send them home, and you should probably take the rest of the day off if you're a patient, because you're kind of metabolizing this lidocaine. We don't want you driving that day.
Yeah.
But you just kind of relax, and then next day back to business as usual.
Yeah, that's what I was going to kind of ask, I guess, next was just then what to expect going forward. So you've had a treatment that lasts, how long did you say? About 30 minutes?
Yeah,
That's
the
how
infusion's
long
30,
infusion
and then you
runs?
recover for 20 to 30. So about an hour and a half of time in my clinic.
Time at the clinic,
Yeah.
and then maybe take the afternoon or the day off to recover and recuperate from that, let your body absorb or metabolize that medication, and then the next day you're
Most of the
doing
time,
well.
starting that day or the next day, your pain is reduced and you're doing well, and you can kind of take off and back to, like I said, business as usual, but hopefully with a lot less pain. I do have, every once in a while, a patient will say they'll have like flu-like symptoms for a couple days. I'm not specifically sure what that's about. I have a thought that it's probably related to cytokines. We know that this suppresses some cytokines, so it could be some residual effects from that. But yeah, typically it's back to normal the next day.
Oh, that's great. Yeah. And then this service at your clinic, where can people find you?
So I'm at Premier Family Medical is the group I'm with. My clinic is Premier Pain and Spine. We're located in Linden, Utah.
Great. And then is there a good way that people would reach out to you, or how would they get in contact with you if
Yeah,
they wanted to come
easy.
into the office and see you and maybe chat about something like this?
Great question. So easy to find us online at Premier Pain and Spine or Premier Family Medical. A lot of insurance require referrals to see a specialist, and so getting a referral to come in and chat about it, we're happy to talk. Whether you want to do it or not, happy to talk about it with people.
Yeah.
And help you, because there are a few like contraindications, patients we need to screen out to make sure they're safe for it. So you need a consultation first, and then the majority of the time we can move forward with it.
That's great. And I'll vouch for you. I've been to your space before and met your staff and into your office. Great people, great location, great place. I think you guys do a great job.
Appreciate it. Thank you. We try to keep it a happy place for people.
I think so, yeah. And speaking of a happy place, I think your unique characteristic there is, correct me if I'm wrong, you were married in your office.
Yeah. We had this was years before I was. Yeah. It was before I started medical school. It was a wedding reception in this beautiful center on the third floor of this building, and then when I was starting this job with Premier, I was talking to the CEO about where do we build the clinic, and we had some ideas, and he's like, actually we have this wedding reception center that I don't think we want to be in weddings anymore. Maybe we can use that as your clinic. And I looked it up and I was like, this is where my wedding reception was. This is where it has to be. So we made it less pretty because we put up walls, but it's it's fun to go where you had your wedding reception.
That's awesome.
Yeah.
Great venue. It is. Nice spot. Nice place. Well, Dr. Brown, we appreciate you. You're a great resource to the community. Thanks for presenting for us today.
The pleasure's all mine. Thank you.